I'm Hansa Bhargava, practicing pediatrician and a senior medical director at Medscape and WebMD. Earlier this year, the American Academy of Pediatrics published updated guidelines for both identification and management of depression in adolescents. The guidelines are targeted for youth ages 10 to 21 and distinguish the differences between mild, moderate, and severe forms of major depressive disorder. The guidelines for the first time also endorse a universal adolescent depression screening for children aged 12 and over. I'm delighted today to be speaking with Dr. Colleen Kraft, the president of the American Academy of Pediatrics, about the new guideline, in particular the issue of identification. Colleen, welcome.
Thank you, Hansa.
Colleen, we're all aware that depression is a growing concern for our teens, but how much of a concern? Do you mind giving us an overview?
Sure. So we know that about 1 in 5 adolescents suffers from depression, but what we haven't had is a strategy to screen them, to identify them, to see is this major, minor, and how to manage them. And we know now that we can do this in a primary care setting. Pediatrics has become the place where we screen our adolescents, where we can make that diagnosis, where we can refer on to some brief therapy, where we can find those answers for those adolescents and maybe even begin to prescribe therapy and follow-up.
Now, why do you think depression is such an issue in our teens? I know the rates have gone up. Is it that we're diagnosing it quicker? Is it that we have less access to care? What are your thoughts on that?
I think one of the things that's happening with depression is that we're identifying more kids.
Okay.
And the rates have gone up, but I think it's because we're identifying more kids, and that's a good thing. So once we're able to identify these young people with depression, then we can talk with them, normalize what their feelings are, but let them know that there is a way out of this, that we can start with counseling, that if needed, we can start with different therapies or even medication, and we can follow them up to see how they're doing and to see how they're progressing in treatment.
Now, you have a particular interest in identification of depression in high-achieving kids who are often subject to much anxiety and pressure. Is this a new phenomenon, or is it something that was just lying under the surface?
So the unfortunate phenomenon that we are seeing is an increase in the number of kids who are high-achieving kids. These are your athletes who are star athletes. These are your scholars who are victims of suicide. And what we're asking ourselves is, how do we use these guidelines to be able to talk with these families and talk with these kids and identify what might be an unrealistic perfectionism or an isolation because of this place where they are? And what are those risks for becoming a victim of suicide?
Do you think that the families would be open to us as pediatricians talking about these issues in a high-achieving family, for example, when they expect their child to be a certain way? And would they actually accept the diagnosis of depression?
I can tell you with one of my patients who recently was a victim of suicide, if I were to talk with her family, they never knew that this was happening or this was coming. And a conversation with that adolescent's pediatrician, who's been a trusted provider for years, about this being a risk factor, if it's something that might have identified this earlier, the parents would have been all for it.
I think it's such an important issue, and we are at the front lines, and we have those relationships to actually use as a platform to have a conversation.
And we know our children, we know what things they're doing. We can congratulate them for being high achievers. But we also know who are some of our partners, some of the sports psychologists, some of the other therapists in the community that can really talk with our teens about their feelings and how to share them and how to accept small failures, whether it's a baseball game, whether it's a grade, but things that will help them build their resilience and attack this whole idea of perfectionism that may lead to them becoming a victim of suicide.
So just on that topic, actually, recent studies show that suicide rates in girls aged 10 to 14 tripled. Do you think that this is due to increasing rates of depression? Is it due to screens? Is it anxiety in a society? What do you think this might be due to.
So it's very interesting. When you see a statistic like that that's so alarming, you want to know what's at the bottom of that. And it could be a number of things. Depression may be one of these things. I think a lot about social media with this. If you think about it, 10, 15 years ago, if somebody was depressed or if somebody did poorly on a test or flubbed up in a game, they had their friends to talk with. And with social media, people are more impulsive, they're less compassionate, and it becomes very isolating for these young people. So I think that may have a place in why our younger kids are becoming victims of suicide. The other thing is, though, the adolescent brain is really developing, and we know that it's not fully developed until mid-20s. And so something that may seem like a temporary setback is just becoming huge in the minds of these young people, and something that they can't seem to get over, and that tends to trigger some of these very unfortunate happenings.
I think it's so sad, and just as you said, social media almost amplifies the issue because it follows them around. You can't get away from it.
Right. And finally, if they have access to a firearm or something that can expedite committing suicide, that really is a factor. So if you are depressed and you have this temporary setback in what's going on there, or if you're a high achiever and you have this temporary setback and you have access to a firearm, you have a 90% chance of completing a suicide.
Now we've talked about the why. Now let's talk about the how. How, as pediatricians, can we do this? The guidelines recommend universal screening. Does the AAP support a specific tool?
So there are a number of different tools that are out there, and we allow our pediatricians their own clinical expertise in figuring out which tool is best for them, for use in their environment. It'll be different whether you're talking about a teen in New York or California or Texas or Montana, but screen our teenagers. And beyond screening, talk to them. See what they're doing, have an idea of what things may be going on, have an idea of other things that may be playing into a higher risk for depression or suicide. Is this somebody who is struggling with a sexual identity? Is this somebody who may be experiencing abuse or neglect or bullying? Those are all parts of the things that a screen will help you with, but it's the relationship that will help to identify that and then move that adolescent to getting help.
Well, I think that all of these issues are areas are so important, and I think as our kids get more squeezed per se with all these forces around them, it's wonderful that pediatricians are standing up for them to help them.
Thank you
very much,
Thank
Dr.
you.
Kraft, for being here and talking about such an important issue.
You're welcome. Thank you.